Cool. I guess we can get started. Hopefully everyone else will join. We're also recording the session so we can share with everyone else. Perfect. Let's do this. Hi, everyone, and welcome to the webinar. We are so excited to have you all here today for a really interesting conversation on how hormones and birth control impact your libido. I'm going to be your moderator for the day. My name is Shadi, and I'm the co-founder and CEO of Tuune. Tuune is a personalized women's healthcare company, and our mission is to ensure hormone health becomes a vital pillar of modern healthcare. We fundamentally believe that every one of us should understand our powerful and unique hormones. Our first product recommends the best birth control method for every individual. We take into account your unique biology, body, and goals, and offer you personalized solutions fully in tune with you. Our hormones impact our libido in a big way, as we will see today. And we're really proud to partner with Rosy for our webinar today. And I will pass it over to the amazing Lyndsey, Rosy's founder and CEO, to introduce herself, and then on to Laura, Tuune's medical lead.
Awesome. Thanks, Shardy. I'm so glad to be here with all of y'all and talking about these really important things, and could not agree more that I think that learning about how our bodies work is the key to kind of unlocking everything. So I appreciate this opportunity and also the work that I know that y'all are doing every day. I am Dr. Lyndsey Harper. I'm an OBGYN in Texas. And when I was in practice, really dialed into the fact that a lot of women that I was caring for had sexual health concerns and questions. So questions about their libido or sex drive, questions about sexual pain, about trouble with orgasm, all of these things that we should fundamentally know, but are just kind of, missing from not only our training as physicians, but also our education as women. So I became extremely passionate about the topic and founded Rosy, which is a company dedicated to women's sexual health and wellness. Our first product is a platform that you can download in either app store and walks you through the evidence-based interventions for sexual health problems. And we're super proud of what we've created. Everything that is on the platform has been created by either a mental or medical professional. And, we're just excited to be spreading the word with other forward-thinking women's health companies like Tuune about how really education and understanding is the key. So I'm so glad to be here with y'all today.
Thank you, Lyndsey, and thanks, Charlie. Laura, I'm the medical lead at Tuune. Super excited to be here. I'm as well a gynecologist. I've worked for several years in clinical practice in hospitals, and 4 years ago, I started in digital healthcare, became passionate about it, seeing the impact that we could have with the new tools that we have nowadays and how many women we can help. And so we are here to help you all, and hope you find the webinar very interesting today.
Perfect. Thank you both. Awesome. So in today's webinar, we'll take a deep dive into sexual health, hormones, and birth control. As you all know, unfortunately, women's sexual health has historically been labeled taboo, and we are really here to change that. Both Tuune and Rosy are on a mission to break down boundaries and help all women and people with cycles access objective information and start conversation that will help us all make better, more informed decisions about our sexual health. And so we want to give you the ability to understand your bodies in order to make informed decisions based on what your needs are now and what's best for your mental and physical well-being. We will be answering all your questions at the end of the webinar, so please post your questions in the chat as we go along. A few housekeeping rules. We won't tolerate any hateful language, and this is not personalized medical advice. It does not replace advice from a clinician or a physician, but is intended as guidance and objective information for you all to make informed healthcare choices. So let's get this started. I'll pass it to Laura to kick this amazing conversation off.
Okay, so we wanted to start today with an image that we probably all have thought of, but we haven't seen it this clearly. So probably we're all quite aware of how lacking is sex education nowadays. But we wanted to find an image to see that more clearly. We've looked at the United States. And so in this one, you can see how, first of all, sexual education is not mandatory everywhere, and there's lots of differences. This image is from statistics from 2019, so 2 years ago. So this is pretty much how we are today, right? And it's the United States, but we can possibly imagine that this is like this, worse or even better in some places, but everywhere in the world. So this, to see it positively, tells us the opportunities that we have to help more people and understand how much sex education can help us and how important it is. So it is vital because we know that it will help improve sexual, reproductive, and mental health outcomes. And we know that it will help reduce rates of sexually transmitted diseases. We know that sexual education will help us promote gender equality and diversity, and that it empowers individuals to become healthier and take control of their actions. So before we go to the next slide, just a quick question. Can you post on the Q&A what state you are? What was your experience? Did you have any sex education? Did you not have any sex education? If you're outside from the United States, as well, tell us your country, what was your experience? Because yeah, that will give us a little bit an image of how we are.
On to you, Lyndsey.
Okay, I was just posting my sex education experience, which was don't have sex and don't get pregnant and don't get an STD. I'm sure that is not an uncommon experience, but it's so funny because I really have come to love this topic so much and I feel so passionately about it. And I think it's really important to understand exactly what does sexual health mean, right? When we talk about sex education, sexual health, are we only talking about STIs? Because that's, I think, what a lot of people think because of the context in which we, have historically thought about it. But what I find so fascinating, so fulfilling about this field is that it really is much more involved. And actually, there's so much to talk about in these areas. And so when we think about what is incorporated in the idea of sexual health, that includes lots of different things. So we're just going to talk about those now. So it includes the cognitive, emotional, physical, and social aspects of sexuality and health. So when we think about just this idea in the top of sexual health, we can talk about fertility management, so potentially contraception. We can talk about sexual violence prevention, consent, right? How to give consent, how to take consent. What does that look like in a practical setting? STI prevention, there it is again, and sexual function and desire. How does our body work? How is, sex intended to happen? What is the definition of sex, right? So all of these things can be involved under that umbrella. And then, we will work our way counterclockwise because I like to end on pleasure because that sounds like the most fun of all. Sexual justice, right, involves a lot of things like we were talking about sexual rights, citizenship, sex positive practice. How can we really change the narrative in our minds from sex is bad and dirty to, sex is something that our bodies were made to enjoy, and how can we really live our lives to the fullest in that context? Sexual well-being, right? So do we feel safe and secure in a sexual context? Do we have respect sexually for ourselves and for others around us? We talk a lot about self-esteem on our platform and definitely, how we're feeling about ourselves and those things. And then when we get over to pleasure, this is the part that I think is the hardest maybe to put all the puzzle pieces together, especially when you're talking about education of maybe adolescence. But I think it's very important to talk about sexual pleasure and even self-pleasure, or AKA masturbation. Like that word that just, one's considered a dirty word, but it is not. And so these things are all very important when we're thinking about what is comprehensive sex education, for us to be addressing them from all of these different areas so that we can really have a complete understanding of what sex means to us, what sex means to those around us, and what sex means, you know, to the global world. So I think it's so important. And if we don't address these things, it will come up, right? It will come up in other ways in our lives. And unless we're proactive about it, then we're going to be dealing with it, you know, in a retroactive way, which is never quite the best way to deal with things. So love this slide. I think I'm ready for the next one. Okay, and so when we look at sexual health, which was that top bubble, I like to think about it, you know, in subcategories or 4 pillars. So we have different things that go into our own personal sexual health, right? We have what's going on with our bodies. We could have maybe just had a baby or a miscarriage, or, you know, any sort of medical problem. Where are we with our hormones and within our menstrual cycle? Where are we in our life cycle? You know, what could be going on physically, like endometriosis or fibroids or any of these things that could affect our sexual health. So that's one part, is that our physical health. Another really important part is our mental health, right? We know that there's such a distinct association between mental health and sexual health. In fact, depression and low desire are the #1 comorbidities of one another. So we often find them together. And the relationship is really interesting, because depression can cause sexual dysfunction can cause depression, and even medicines that we take for depression or anxiety can cause sexual problems, right? So there's quite a complicated relationship, but it's something that is really important to know about, because that way we can find, okay, if you need to be on a medication for depression or anxiety, which I know most of us would support wholeheartedly, then we want to pick the right one that is least likely to affect your sexual function in a negative way. So something really important to keep in mind. Another piece of us, right, our sexual fingerprint, which makes each of us unique, is the religion or culture that we were brought up in, and how are we taught to think about sex. As I mentioned, you know, when I was growing up, I was in a religious school, and the nuns that was not their favorite topic to talk about in a non-fear-based way. And, you know, so a lot of us have that experience where we're meant to have this, you know, sex negative view growing up, and then we're in a situation in which all of a sudden in our culture or religion, sex becomes permissible and even desirable, and we're expected to really you know, be the outward projection of sex positivity. And that's a really hard switch for people to make, always. And so that is a very understandable problem. And then we go back to the education component, which I think is the key to everything. You know, people you know, people with clitorises are running around thinking they should have orgasms from penis and vagina sex, right? We don't even have like the basis fundamental, you know, education that we need to feel that we are doing things sexually right. And then the last part is relationships. And this can be either our relationship with ourselves, which we kind of touched on last time, like that body image, sexual confidence piece, or it can be the relationship with a partner or multiple partners, right? How is sex treated within that relationship? Does that person have sexual problems or mental health or physical problems, right? And so when we introduce someone else into this paradigm of sexual health, we bring into it all of the things that they have going on that we've just discussed as well. And so while that can be amazing and beautiful, it can also bring with it its own specific challenges. So it's really important, I think, to have this, you know, big picture view of what does sexual health mean to each of us as individuals, so that if we are experiencing a challenge, which everyone does, right? Our sexuality and our sexual health kind of waxes and wanes as we go through different phases of life, that we can really objectively, as much as possible, step back and say, hey, what could be contributing? And that many times there's more than one thing, and that's okay, you know, but that way we at least have the baseline knowledge we need to take action. Okay, so now we're drilling down even further into sexual desire or libido, and what can kind of go into that, right? And so when we look at low sexual desire, that is the #1 complaint that physicians hear from women when it comes to sexual problems. And in fact, it's reported by about 43% of women. And so we really want to take a look at what could be causing that. We discussed mental health, so that could be that the depression or anxiety is causing low desire, or the medicines for depression and anxiety are causing low desire. Hormonal changes, right, which we will talk about in just a minute in detail. We experience during each cycle. We experience during and after pregnancy, during and after menopause, our genetics, right? So people are predisposed to certain medical and mental health problems that could be affecting their sex drive. Vaginal dryness is no fun, you guys, and it can really affect, right? So this is one thing when you train as in sex medicine, it's the very first thing you have to ask. If you have low desire, do you also have sexual pain? Because if you have sexual pain, you would never want to have sex, right? Like that doesn't make any sense. You don't want to stick your hand in a hot fire once a week or once a month. That never feels good no matter what. So if you have sexual pain or because of vaginal dryness or because of some other reason, then that, we have to address that before we can really look into the low sex drive. Menopause can cause low sex drive for many, many reasons. We could do a whole other webinar for that. We talked about painful sex. Stress is the #1 killer of libido. And it's because we just promise ourselves to so many things that we really want to get done, but can't. Relationship issues, as you can imagine, lack of sleep, hormone replacement therapy or lack thereof, potentially, birth control. So our choice of contraception can actually have a positive effect or potentially a negative effect on our desire for sex, which we'll kind of get into in a little bit. And then lots of other medications. It's really important to do a medication review with someone who understands this well so that they can say, oh, you know what, that antihistamine you're taking for your allergies can cause vaginal dryness. And that's, I mean, in Texas, we're all on antihistamines. I don't know about where y'all are, but allergies are out of control. So there can be really common things that, you're like, oh, I had no idea, that can really have a negative, or like I said, a positive effect potentially, but it's important to look into all of those different things.
And so we don't want to get too technical here, but we do understand that it's very important that everybody understands the basics of how our body works so that we can understand what's happening, right? What Lyndsey was saying, we need to know where we're at to try to tackle if we have any issue or any problem. So this image is an image that as doctors, we're very used to. You can see loads of lines. So basically, you're seeing how women's hormones are varying during a cycle, right? So let's agree, a cycle, we usually say lasts 28 days, even though we know that very few people actually have cycles of 28 days, but let's take that number. So you see that we've got 28 days there, and in the middle, more or less, will happen the ovulation. And this can vary from one cycle to the next cycle, but it will stay more or less similar. So that it can be different, but it will every month, if you are ovulating, you will have these variations and these variations in your hormones. And that obviously will have an impact in the whole body because hormones will travel all over the body, and it will not just have the impact of you ovulating and you having your period. It will have so many other impacts, right? So if we look at the next slide, you will see here the estrogen. So estrogen is one. We're not going to look at all the hormones. That's fine. We're just going to look at 2 of them that we think are important. So estrogen is one of the most important that are related to libido. And you can see that estrogen, it actually goes very high up just before ovulation. And that happens every time we ovulate. And estrogen is a great hormone. It makes us look awesome. It makes us glow, and it's very related to libido and to sexual desire. Then the next hormone we're going to look at is testosterone. And yes, we know testosterone for men, we know it's very important, but we have to take into account that it's very, very important for women as well. And we frequently don't think of testosterone. So testosterone also peaks right around the ovulation. And that combination is very important because we can see in the next slide that testosterone and estrogen, we'll see right now the next slide, there you go. Testosterone and estrogen actually have a very, very important role in our libido. So high estrogen, high testosterone will put us in an excellent libido meter, right, to the right. And that happens usually around ovulation. And afterwards, it's true that estrogen goes a little bit high again on the second part of the cycle, but we've got other hormones there like progesterone. So we usually there's not that much impact, and testosterone will go down.
So I love that we kind of dove into the menstrual cycle with hormones, because I think so many of us don't, I mean, even as gynecologists, you know, I think we spend so much time working on that, but generally, I think people don't understand. So I love that. But I think another thing that's so fascinating is what happens to our hormones as we age. It's not, as I'm aging, it's not so fascinating, but, you know, to understand the ramifications of it, I think are really, really important. So our hormones change, you know, as we age. And as, you know, these represent the same main three hormones that we just talked about. So this green line is testosterone up at the top. The purple is estrogen, and then the pink is progesterone. So you can see that the green line peaks in the, you know, I would say mid, probably to late 20s, and then starts its reduction, right, over time after, and it says 50% reduction from age 40 to 50. And so as testosterone drops, many women do experience a decrease in their libido. And that's actually a really common symptom in the 40s, the perimenopausal time and the menopausal time. And then the estrogen here in the purple, there's a 35% reduction from age 35 to 50. And as Laura was saying, that can be experienced as, you know, skin changes, weight distribution changes, changes with the vagina, vaginal dryness, and also the strength of the vaginal muscles are all dependent on estrogen. We can have increased risk of urinary tract infections with low estrogen. So there's a lot of amazing things, memory, that estrogen does for our body, bone health. I could just go on. And we, you know, as it starts to decline, we really start to feel those effects. And then that's really what happens at menopause, is that estrogen, you know, goes down enough to where we stop being able to induce our monthly cycle, or that ovulation that, like you saw in the chart a minute ago. And then also progesterone declines during those years as well. So there are a lot of effects of these hormonal changes on our bodies. And it's important to be cognizant of that. So not only are we having hormonal changes each month, right, as we experience cycles, but relatively those hormones are kind of decreasing, right, as we're in our 30s and 40s, and then definitely into our 50s. And the average age of menopause is about 51. So by the time that happens, you know, that estrogen has fallen below the threshold necessary to induce ovulation. So now we're going to move on to actually the topic of our talk, which is birth control and sexual health. And we all felt like it was really necessary to have that fundamental understanding, right, of what are hormones doing normally. So everything we were looking at a minute ago is what hormones do normally when you're not adding any hormones to the body. And so now we'll discuss the different types of contraception and how they change, right, either in one way or another, or some of them actually don't change your hormones, and kind of what that means for your sexual health. So when we as gynecologists think about types of contraception, we really divide them into two groups, right? Long acting and short acting. Short acting just means it's out of your body really quickly. Like when you want to take it out, you can take it out and you can reverse your fertility, right? Long acting are meant to stay around a little bit longer. So months to years, right? And short acting are more like days to months. So long acting would include IUDs, and there are both hormonal and non-hormonal IUDs. There are implants that can go in the arm with estrogen in them. There are injections you can get in your arm. And then there are other devices that can go in the uterus that we don't have yet approved in the US. Do y'all have them over there yet? I don't know. I think it's getting soon. And then there's non-reversible types. So permanent sterilization, like getting your tubes tied, or, you know, your husband or your male partner having a vasectomy. And then there are short acting ones, right? So we've got the pill that everyone talks about frequently. We have a ring that goes into the vagina, a patch that you can wear on your skin, a progesterone only pill that has no estrogen, as in contrast to the combined pill, which has estrogen and progesterone. And then the non-hormonal short actings, like both male and female condoms, Natural Cycles, which is an FDA approved app for contraception, which works with fertility awareness, as is here on the bottom, sponges, diaphragms, withdrawal method, which I'm not sure how Tuune feels about withdrawal. I have not seen it be very effective in my patient population. Cervical caps and spermicides. So it's important that you're aware of, all the different options for contraception. And this is something that I love doing, is counseling patients, just like Tuune's product does, to try to find the best one for you, right? Because it's not like, what's your favorite birth control? I think we get asked that all the time. What's your favorite one? It's like, well, I mean, that totally depends on your goals. That depends on, your other medical conditions. That depends on your future plans. So there's no right one for everyone. There might be a right one for me and a totally different right one for Laura. So it's really important that you understand this holistic view of contraception, of sexual health, of the, sort of medical and mental health things, so that you can choose the one that's right for you. And without understanding this, I don't think that you can do that.
Absolutely, Lyndsey, spot on. And just a fun fact for everyone, there are about 224 different hormonal pills available, so oral contraceptives, which obviously makes things even more complex. But here we go.
Yeah.
On to the next slide to Laura.
Yes. So now we're keeping in mind what we mentioned before about the hormones and how they cycle every month, and keeping in mind the different options of contraceptives. We're going to mix them and see what happens. So what happens here, what we're looking at, is how hormones fluctuate or not during whilst you're taking a combined pill. So the different fluctuations that we're seeing there actually are the estrogens and the progesterone of the combined pill, because you're taking it every day. So every day you take a dose of those two hormones. It can be different, right? So there's different types of pills. There's pills that have the same dosage all every day. There's pills that have different dosages, but the idea is that every day you take a pill and you're having that dosage of hormones. So what happens with the hormones that you had in your body in the meantime? Well, actually, those hormones are sending messages to your brain to say, well, you don't need to produce any other hormones. It's fine, we've got enough. So our hormones, the ones that we produce, are the lines that you see down there that are not variating at all. So all these changes that we were seeing before, they're not happening anymore, which is the idea, right? Because we don't want to ovulate, because it's a contraceptive. So we want to avoid a pregnancy, or at least that's one of the ideas of contraceptives. And we're not ovulating, but that also means that we're not having that high estrogen right before the ovulation. So our libido can be there a little bit changed. However, I have to say that science has not been spot on with libido and contraceptives. So we've seen that some women with the same contraceptive, some will have a lower libido and others will have more libido. So there's a lot of variation there. And that's why Lyndsey was saying, so what is good for me might not be good for someone else, and the effects might be different. But the idea is that hormones will have an effect on our, contraceptives will have an effect on our hormones, and that's on estrogen, but they also act on testosterone. And usually they make the testosterone that we are able to use, what we call free testosterone, be lower as well. So both things that we said were important for libido, they usually are very quiet whilst we're taking a combined pill. And something similar happens with a progesterone only pill, right? Here you can see just one color, because we said it was just progesterone. We don't have estrogen in this one, but actually the effect is very similar. So we're putting our body on a progesterone continuously, and we're stopping our hormones. So the effect will be very similar to the one that we had before. It is different if we have non-hormonal contraceptives. So we come back to the different variations that we had before, right? Because we're not giving our body any hormones. So this could happen, for example, if you have a copper IUD. So you will have your copper IUD, it will do its job as a contraceptive, and your hormones, the ones that you produce, will continue and do their job as well. So ovulation isn't suppressed, and therefore we would expect your libido not to be affected. I have to say that there's still a caveat, right? Because we're looking at all this from like purely the scientific point of view, like this hormone does this and that's why libido is like this, but there's a lot to take into account, right? So probably there's a lot of women that taking their pill every day, even if scientifically we know that it's gonna probably lower the libido or could lower the libido, maybe they have the mental state saying, okay, that's fine, I can enjoy sex, I'm not gonna get pregnant, and their libido therefore could be better, right? They're gonna take out that worry or any other contraceptive. So that part is very important as well. So we have to take into account all things, because as we were saying before, it's not just hormones, there's loads of things going around.
Perfect. And I think another fun fact that I'll add here, your natural hormones, some people have higher libidos, some people have lower libido. So it's not just, contraception that affects it. Your bodies could just react differently naturally.
Okay, so we've talked so much about, I feel like, so many good things that aren't generally well understood. And this one really kind of ties the topics that we've been discussing all together, right? So when we talk about the hormonal effects of birth control on just our lives generally, but more specifically on our sexual health, and then how that fits into the bigger picture of our, life entirely, then we can really start to put together, how does this fit within our lives? Like, which one is the best for us? And just as Laura was talking about, there's so many other things to think about when it comes to birth control. If you or contraception, when you are not able to what you feel, and you get to decide what that definition is, reliably prevent pregnancy, right? So then you are going to naturally, if you do not desire pregnancy, want to try to avoid sex, which could result in pregnancy. So whenever we add contraception, generally speaking, that could alleviate that fear, right? Whether it's hormonal or non-hormonal. And then you could experience a little bit more freedom, just like Laura was saying, in terms of your own permissions for yourself. There's also many cultural factors that go into not only sex, but also contraception, right? We hear all the time about certain populations who have trouble with or there's like a lore in their culture that you should definitely not get an IUD, or you should definitely not XYZ, or you should definitely not whatever, and that is important to take into account, because no matter how much education we do, some people, we are setting them up for failure if they truly feel that is not a good decision for them. And so that's why it's so important to have shared decision making, right, with your clinician or your physician, because just like in sexual health, we have to know where you're coming from so that we can get to the desired result, because this is all about you, right? We don't care. We do, but not what, it's your decision. So it's important to understand the cultural factors that are important. And then of course, your medical history is so important when choosing contraception and when talking about sexual health, right? If we have a chronic medical disease or condition, if we do have, a sexually transmitted infection, there's a lot of things to take into consideration when you're thinking about the best choice and how it could affect your sexual health. And then this individual goals and desires kind of goes to what I was speaking about earlier. What are your goals? Do you want to prevent pregnancy before you're ready to have, another child in a year? Do you never want to have children and are worry 100% about that? Do you probably think you might never want to have children? There's a lot of different things to consider. Are we having sex with, one partner or multiple partners? Because all of these things can go into the right choice for your contraception. And so, it kind of goes back to what Laura was saying, which is that we have some data about contraception and how it affects sexual health. And we know that most likely that the non-hormonals and the long-acting reversibles, so like the implant in the arm and the IUDs with hormones, have the least effect or the least negative effect on sexual health. And most likely the combined pills have the most negative effect. So that's something to keep in mind, but it's not the same for everyone, as we were just discussing. So sometimes, unfortunately, it is a little bit of trial and error, but when you go into it armed with all of this information, you can make a really educated, first step towards finding your perfect match for contraception.
Perfect. Thank you, Lyndsey, for that. Yeah, and just to sort of reiterate, you know, here at Tuune, that's sort of our main goal, to really understand, you know, first and foremost, what are your desires? Secondly, what are all the symptoms that you currently experience? What are all the side effects you've experienced previously? Because all of those things will come to the equation to then build a model to say, this is what's happening to me currently. These are all the risks that I carry. These are all the things that I'm looking for. And so understanding the risks and benefits of different methods that are out there. But at the end of the day, it's really about, you know, understanding, getting a clear understanding of who you are and how your body operates and what your goals are. And obviously Rosy does that perfectly with sexual health and sort of libido. Again, it's the same thing, right? If you don't know that, you know, fear of pregnancy may impact, you know, the way that you have pleasure during sex, then of course, you know, that's a blind spot for you. So it's really, how do we debunk these myths and make sure that we take the blind spots away? And here we go. And this is the end of the webinar. So thank you, everyone.